All right, good morning, everybody. It is 10 a.m. We're going to go ahead and call to order the Public Safety Committee meeting for Tuesday, February 3rd. First order of business is the approval of December 2nd, 2025 minutes. All right, all in favor? Any opposed? All right, motion passes. Next is the written report regarding the lift help fees from Fort Fire Department. Do we have a presentation on that or just a report?
Just a report for the committee's information in response to the request.
Okay, so as expected, whenever we'd ask for this, just because of the large number of calls to private facilities for lift assist in non-medical emergencies, and the amount of time and resources it was taken, seeing what other cities are doing to try to mitigate some of those resource uses, whether that be in the form of smaller fees or higher fees. I don't know if everyone on this body has had a chance to take a look at that report, but I would certainly recommend taking to mayor and council a policy where we do enact some sort of fee structure for those non-emergency lift assist fees, especially for those private facilities. And again, these are for the facilities that are really taking these resources when they should be in my opinion, should be employing the resources to be able to do that job for them. Not leaning on our taxpayer resources, taking them away from what could be real emergencies. It's an unfortunate situation they're in there. However, that's some of those facilities I believe should figure out. I don't know what the city's stance.
Mr. Chair, if I may, I would just like to add that staff is looking at a number of fees in addition to this fee, and we are planning to come back to you later in the year, probably as part of the overall budget process, to make recommendations that would address this fee and many other fees that we're looking at now, related to fire, EMS, public safety, et cetera.
Got it. And then looking at some of the other fees that were in this report regarding vehicle accidents, is there any process now where insurance companies are charged? I'm sorry, Councilman. Yeah, are there any processes now where these insurance companies are being charged for the resources that the city is using to help clean up and take care of some of these motor vehicle accidents, or is that just something that we take on?
I think we take on most of the cleanup, but I know that we work with RISC to look at opportunities to go back and subrogate, go after other insurance companies, et cetera, for damages that might be caused to our equipment, et cetera.
Okay, because I do remember at one point, I believe it was last year, we discussed, some accidents that were, when they damaged city property, where it'd be signals, you name it, and the success rate of getting the insurance companies to pay for those was so low that, from what I understand or remember, we just kind of stopped going after that. So if we can just get an update on where we're at with that, so we can make sure that if damage is caused by motor vehicle accidents and someone just not paying attention, that their insurance, if they are insured, is covering those charges. So our taxpayers aren't having to pay for that. And then in the meantime, while we wait on those reports for the lift fees, is there a way to look at, because I'm just trying to make sense of the these institutions where it looks like Green Oaks Boulevard, for example, 88 calls in 2023, 109 in 2024. 83, is that one specific facility that's having all these call outs? Or I don't know, Chief Hill, if maybe you might have any insight on that. So looking at that report, where it has the chart for all these different roads, but it says institution, but it has this street name, and then how many calls for lift assist they got. Is that one specific facility? That's
Ray Hill, interim fire chief. Actually, it's the independent living facilities, and we do have a high number of repeat dispatches to those places. So those are the majority of our non-emergency lift help calls.
okay. Got it.
So these are specific, like one specific facility with numerous calls.
Got it. Is now on those calls, is it explained because right now the policy is we go out there, we provide the assistance, correct? Like there's no questions asked.
Yes, sir.
Are we doing anything at the city leadership level to basically tell them, hey, you're taking advantage?
So at this point, we're looking at what we're going to be able to come back with in terms of proposing fees
Okay,
to address especially the excessive repeat folks that are calling for lift assist. Right now, there's no charge for that service, no additional charge for that service. It's just something that historically has been done, right?
Yes, sir.
At no cost. So we're evaluating everything. Now that we have, I guess, had to really focus on this with incorporating EMS into fire, and a lot of those calls, some of those calls may come to what used to be MedStar, et cetera. We're looking at all of the fees associated with it and the impacts that it has on operations, response time, and revenue generation.
got it. Okay, thank you. Okay, so we will look forward to getting that report. Chief Hill, thank you so much.
Thank you.
Anyone have any questions on this?
Yeah, I hadn't seen what we're talking about, but are they going to the hospital? Where are they going?
They're not going anywhere. They're just simply going there to help get them because they fell down
Ah.
and they're large, or they don't have the staff on hand that can actually help
Got it.
get them back up. So it's not an emergency. They're not taking them to the hospital. They're just putting them back in the lazy boy or the bed.
Got it, thanks.
So any other questions, comments on this one?
I think if we're going to talk about a fee structure, though, we need to make sure that we are delineating between frequent users that are private citizens who need that support. We shouldn't be charging them, like even frequent flyers need help. But institutions where they should, by the nature of the facility, have people on staff that should be able to provide that level of support. I think the problem that we're going to run into is that for many of those institutions, the reason that they call for a lift assist is because of liability purposes. They don't want to be the person lifting in case there's a drop or a fall. And so I think that's probably a bigger reason why we're getting those. And it shouldn't be for us to mitigate risk. So in that essence, or to that end, we need to be looking at institutions, not individuals.
So that's 100% what this is.
Yeah.
This is not, as far as the home calls, that would just be status quo. This is for those facilities who probably don't, like you said, that they're trying to mitigate risk there, and maybe they have workers' comp issues there too. So, okay, so we'll look forward to getting that report. The next is opioid responses presentation from Keisha Light.
Good afternoon. Good morning, excuse me. Keisha Light, Assistant Neighborhood Services Director, here to give you a report and overview on the Texas opioid settlement funds. These are some funds that we've received from a pharmaceutical settlement in the last few years. Also here is Deputy Chief Horton and Bethany Warner and Tara Perez, so they'll also be available to answer any questions specifically to their funding requests and the programs that they're doing with these funds. So I'll first give an outline of the presentation. We're going to do a timeline from where we started to where we are now to where we're going, and then we'll talk about the awards that we received to date, talk about some allocation of unprogrammed funds and how the funds have been used, and then we do have some monies we need to allocate, so we'll talk about those funding requests, and at the end we'll have time for questions and discussion. So November 2021, City Council approved a resolution which approved City of Fort Worth being able to receive some of the funds from this settlement. In March of 2023, we received our first payment of around $665,000. The following month in April, there was an MNC approved by City Council to not only approve the funds to be used in our city, but also to designate Neighborhood Services as a lead department to oversee the allocation and use of the funds. So we're anticipating over the 18 years, the total payout to be nearly $2.6 million from the initial settlement. There has been a subsequent settlement, and we're anticipating an additional $2 million from that one over during this time period. In October 2023, we conducted our first RFP soliciting nonprofits and social service agencies and city departments to be able to request funding to be used for the opioid crisis that we're experiencing, to be able to use those funds. In December of 2023, there was a Another MNC actually awarding the agencies that had applied to the RFP and were awarded, and that was UNT Health Science Center, My Health, My Resources of Tarrant County, and the City of Fort Worth Fire Department. In April the following year, we received our second payment, around $129,000. And in March, we held a second RFP process, and also 2 information sessions were held to explain more to the community and have opportunity for them to come and hear more about the funds and how to apply. And in April 2025, we received a third payment of $631,000. That's the amount we're looking today to discuss with you for the funding request that we have received. In June, City Council approved the MNC approving the use of the second and third payments, reducing the fire department's allocation, and awarding funds to only one agency at that time, and that was UNT Health Science Center. This chart here shows our initial settlement award in that first column, the second and what's been revised, and then what we spent today. So to date, we've spent $427,000, and you'll see the remaining funds is just under $1 million. You see that $632,000 that I mentioned earlier. That's what needs to be allocated. That's unprogrammed funds right now. We are anticipating, you'll see in a moment, to give those funds to the fire department, to our homeless strategies team, and then also a small, very small amount to admin expenses. We've also learned recently with these funds, we have interest earnings around $75,000. So we're working with FMS right now to figure out how to allocate those monies as well.
Can I stop you real quick? Can you let us, can you tell me a little bit more about what the program, the UNT Health Science program does?
That program, Safer Care Texas program?
Yes.
I'm sorry, I'm not as familiar with this
Okay.
program. I don't know if some of my helpers here have Deputy Chief or Home Strategy. Are y'all familiar, Homeless Strategies? We can definitely get that answer back to you.
Okay, thank you.
Here's a list of how those funds can be used. So we can use to purchase medicine, treatment of incarcerated populations, services to pregnant and postpartum women. There's a host of activities that we're able to use the funds for. And you'll see in a moment with the 2 new funding requests how they plan to use the funds. This list shows the approved uses based on treatment, prevention, and other strategies. And here is funding request allocation. We'll get into the details in just a moment. So the fire department was requesting a $410,000 for peer support, expanded treatment access, and community engagement. We want to do outreach out in the community. Homeless Strategies requested $297,200 for their high impact program, but just with the numbers that we received, we had to reduce that amount a little bit, so they'll receive $221,385. And then Neighborhood Services, as I mentioned earlier, it's a very small amount of just $500 for administrative expenses.
I'm glad they're getting that extra penny, though. That's good. I'm sure they're very thankful for that.
Okay, so the fire department's funding request, the ultimate goal is to improve recovery, reduce overdoses, and build community resilience. So in both, in the positions that you hear from fire department and in Homeless Strategies, they will be contracted positions or working with a nonprofit organization to actually contract those. They wouldn't be city-led positions. So first is to fund a peer support specialist for the overdose response team. They also want to get more out in the community and provide more awareness and reduce stigma, do more community events, then continue to support existing roles of peer support specialists and a mobile integrated health paradigmic, and then also expand medication-assisted treatments to purchase more medicine to assist our residents.
Yeah, Mayor?
And this may be a question for the police, for the fire department, but related to the overdose response team, prior to our partnership with MedStar coming in-house with the fire department, those services were in partnership at MedStar with Recovery Resource Council, and it was a very effective program. My question for the fire department is to make sure we're not creating redundancy, and have they had a conversation with Recovery Resource Council to make sure that's not a service that they could be providing today in the community?
Mayor, I can answer some of that question for you, because we actually recently just had a meeting with the fire department and Resource Recovery Council to make sure that we weren't duplicating efforts. And I don't want to speak for Chief Hill, but I did hear from his counterpart at the Resource Recovery Council that thanked them for that meeting and has said that since that meeting there has been enhanced coordination and communication. So I'll let you tell us what we're doing, but that's my patting you on the back for doing it.
So the funding that we'll receive, we're going to use that to increase the overdose response team. Right now, we have a MIH paramedic, which is already authorized staffing for the fire department. They will team up with a peer support person. Right now, we're going out 2 days per week. With the additional funding, we'll be able to offer services 4 days per week. So it's not duplication of services, it's expansion of services.
For clarity, how do you currently plan to work with Recovery Resource Council?
We'll use this funding. What we don't have funded is the social worker, which is another component of the overdose response team.
Okay.
So that funding will help. We'll partner with another agency for a social worker. We will expand our services from 2 days to 4 days, and that partnership is with Recovery Resource.
Okay, that's great. Thank you.
So here's the layout of their budget requests. So that existing mobile integrated health paramedic, 223,000. The contracted peer support specialist, 114,000. The community events, 30,000. Medication, 32,000, and then administrative expenses for $10,000, for a total of $410,204.
I have some questions. Okay. Thank you so much for putting this together. I appreciate it. So in regards to the funding that was requested from the High Impact Program, is that going to be additional resources that we're putting into the High Impact Program, or does that help subsidize the total budgetary cost of the High Impact Program?
Tara here? Yeah. Come on up, Tara.
Tara Perez with Homeless Strategies, thank you. It is an expansion. It is to add a position through MHMR for a chemical dependency counselor. And what this does is, as y'all know, we're in the process of expanding the program that you requested we do. And so when we add another staff, we also are able to utilize 10 more housing vouchers. So this helps us on the housing and the services side.
So with this addition, what is the total number of housing vouchers we'll get?
We'll be able to request 10 more
Just-
because of this position.
So if we added, say if we decided next year we got $800,000 and we wanted to add a second, or another chemical dependency position, that would open up again another 10 more vouchers.
Yes.
Okay. Well, this is exactly what I was going to ask that we do with these fundings. So I appreciate y'all reading my mind on this, that I wanted to make sure that in our high impact program that we were looking at funding specific to chemical dependency. And so I like what we're doing with it. I don't like that I don't know what UNT Health Science did with it, but I think moving forward, it would be my preference that we keep this money in the city. Just by the two funding requests that we've seen here with our high impact program and our HOPE, our fire department expansion, I think that there's more than enough that we can do to capture that money and do it here within the city, as opposed to our current programs, as opposed to future RFPs for outside agencies.
So the funding requests today, we did decide not to do an RFP and just to allocate the city department. So I believe that'll probably be what we do moving forward.
And then my one last question, so I noticed, it looks like we got 600,000 and then 100,000 and then 600,000. So is that a pattern that we can expect over the years? Because it says it's going to pay out over 18 years. So do we have a schedule for how that funding is going to look for budgeting purposes?
From my understanding, it's pretty random. So
Okay.
we're anticipating another set of funding sometime this spring, but we don't know when or the exact amount.
Oh, that's perfect. Okay, great. Thank you.
Unpredictable government, say it ain't so.
But to Elizabeth's point, that's even more a reason why if you keep it in-house within our own departments, you can create consistency so that if there's a delay in potential funding, say, on the program we're working on, then they have a better chance to keep it sustained rather than having to wait on funds or cutting things off, so. Exactly, yeah.
Sorry, go ahead.
So here, Lisa, we want to make sure we're measuring our impact and making sure what we set out to do, that we're actually having that impact out in the community. So this is the evaluation plan from the fire department based on their grant funding request. So they want to track the number of individuals supported by the why do I keep saying that? Paramedic and peer support specialists, as well as monitor the decrease in repeat overdoses within 6 months post-intervention, and then track the percentage of opioid use disorder patients, measure attendance and engagement at those community outreach events we discussed earlier, and then also do some feedback surveys and focus groups with those that actually participate in their programs. The Homeless Strategies funding request, the goal is to increase the use of substance abuse services and benefit clients as well as the public safety and well-being of the city as a whole. And Tara just mentioned they're wanting to hire a licensed chemical dependency counselor, hopefully to be able to keep that person in place over the next two years and increase their number of clients they're able to serve by 10, and then, of course, purchase some medication as well. Here's a breakdown of their budget. So $140,000 will go to the counselor that would be contracted through MHMR. Operating expenses of $3,200, administrative expenses around $10,000, and then the medication around $68,000 for a total of $221,385. They too want to make sure they're having the impact, and you'll see their performance criteria, what they're planning to track. They're going to track the percentage of individuals accepting a housing offer after being housed, percentage of clients that stayed housed, and then a percentage of clients being treated for opioid substance use disorder. This particular funding, after she strengthens our ORT through peer expertise and expanded treatment at emergency point of care. Those community events, as we mentioned, will increase awareness and reduce stigma out in the community with these types of activities. Funding also provides opioid substance abuse counseling services and medications for formerly unsheltered residents, for those who are really in need in these services. So combined efforts, our overall goals are to mitigate overdoses in Fort Worth, promote healing, and build community resilience. Next steps. So next month, February 24th, those meeting requests for those unprogrammed funds will be presented to City Council for approval. We're also working with, as I mentioned, we have that $75,000 monies that we need to allocate as well. So we're working with FMS to figure out where we put those funds, and then identify additional funding opportunities as future settlement payments are received. With that, I'll stand for any questions or open discussion.
Any questions on that? Something Mr. Johnson just brought up is possibly being able to use those interest earnings in increasing some of those numbers, since it looks like there's some that were lowered because of budget shortfalls, but then looking to see where we can allocate the 75 really makes sense to be able to allocate to that. So looking forward to hearing back on that. Are there any questions or comments? Okay. Thank you so much.
Thank you.
Appreciate it. All right, next is the Public Safety Partnerships and Homeless Strategies Programs, and Tara Perez is here to give that presentation.
Good morning.
Good morning.
So really quickly, I'd just like to overview our homeless system and homeless strategies, and then talk about two programs specifically that overlap with public safety. So this is our homeless population. As you can see, the light blue line is our continuum of care, which is Tarrant and Parker counties, whereas the city of Fort Worth is the black line. The city of Fort Worth has about 81% of the homelessness in our area. This is a snapshot of our continuum just for this past December, just breaks it down a little bit about who is homeless. As you can see, we've had a lot of success in being able to house a lot of veterans. Also, there's some dedicated funds for young adults and families. The vast majority of people are single adults over 25, though. This is our continuum of care structure. The Continuum of Care Board is the policy-making body. Mayor Parker serves on the leadership part of that COC board. I serve and represent the city on the membership part of the board. Partnership Home is the 501c3 nonprofit, formerly Tarrant County Homeless Coalition, that carries out the mission of that board. The city participates in several ways, funding different interventions. So Homeless Strategies is a two-person unit in city manager's office. We oversee about $6 million in general funds and also some state funds. And we also work cross-departmentally on problem solving and organizational alignment because there are a lot of departments that are involved in homelessness. This is an overview specifically of our general funds. As you can see, today we're going to talk about two programs specifically, which are the High Impact Program and also our Street Outreach Program. Wanted to point out that through conducting stakeholder interviews and in particular listening to the wishes of many city council members, we were able to triple the budget for street outreach. So instead of having 2 street outreach workers, we now have 6. So that tripled that outreach budget. Okay, the first program that overlaps with public safety is our High Impact Program. As y'all know, we targeted 7 specific areas of the city with a lot of unsheltered homelessness, and these are the areas in several different council districts spread throughout the city. The criteria to be referred, almost all of the referrals came from our NPOs, and the person had to be unsheltered in that area and either unsheltered in that area 2 years or more or suspected of having severe mental illness. So what our hope is to reduce the law enforcement time and interactions with these individuals. So a lot of these individuals are very disruptive, not only to neighborhoods, but also to businesses due to their severe mental illness. These were our goals, and these were the outcomes of the 17-month pilot. At that time, 86% of people accepted their housing offer. 94% who were housed were still housed 1 year later, and we hit our goal of serving 80 clients. As we mentioned earlier, we are adding 30 vouchers, so we're in the process of expanding to be able to serve 110. The profile of the client in High Impact has been unsheltered homeless 7.5 years, is 54 years old. The median number of times people had to ask if they wanted housing before accepting is 1. So when we look a little closer at our client profile, 95% of the folks suffer from severe mental illness, and 73% also have substance use disorder. When we looked more closely, we found that 10% of those clients suffered specifically with opioid disorder. One of the things that we've noticed is we're tracking is what percentage of clients accept services. So there's a psychiatric physician assistant on the team, and we're now seeing a rate of 63% of clients that are receiving psychiatric services. We have 29% of folks that are accepting drug treatment services, and that was behind our ask for the chemical dependency counselor from the opioid settlement, because we hope to boost that number. Although we had some high utilizers of our health system, a lot of the folks in High Impact were not really on the radar of our outreach teams in the community or the health systems. It was law enforcement, was the one that they were interacting with very frequently. Again, we saw this working with NPOs really influence some of our future decisions about outreach, just understanding how NPOs know their areas so well and are able to leverage those relationships. We are in conversations with fire and EMS, thinking about our program growth and effectiveness for high impact. So the second program that we think overlaps with public safety is our targeted outreach. So we have 6 outreach workers that are funded by the city, so it's now 3 teams of 2. And so we have divided them up. We selected the high impact areas because they have large percentages of unsheltered homelessness. And again, high impact just serves those with severe mental illness. But those areas have a lot more unsheltered folks than high impact can serve. And so we went back to some of those same areas. So now outreach is targeting in Northside Stockyards. We also have folks that are on near Southside and East Lancaster. So in the first quarter, they met with over 613 unsheltered folks. The big emphasis now is that traditionally outreach has been, the purpose of outreach is to connect people who are unsheltered with housing. So it's been a lot of discussion about when there is a pause in housing resources available, what is outreach's new role? And so we are really exploring more pathways, leaning more toward employment or diversion or treatment. We continue to find that it does make a difference who asks people for services. Outreach continually has more people that say they accept services than if someone in law enforcement asks them. Any questions on those programs?
Thank you so much, Tara. Any questions? So one for me is on the severe mental health. Whenever you said they're disruptive, can you explain a little bit more? Like, what do you mean by that? Just the presence, or they're causing issues in the neighborhoods or the businesses? Can you provide clarity?
Okay, so some examples from some of our high impact clients. So like if you have someone that's downtown, that's not always clothed, or that's screaming at people, that's disruptive to the businesses in that area, and so they get a lot of calls on that person because of that person's mental illness. So when we're able to house that person, that gives them the opportunity to connect with treatment and to be in housing and not to be that disruptive person in that area anymore.
Got it. Okay, and then for those, I thought it was great that 63% are receiving psychiatric treatment. And then seeing as how 95% do have severe mental health issues, what's happening with those who aren't receiving that psychiatric treatment as far as like still being disruptive, or they're housed now so they're not disruptive, or what are they doing as far as like ensuring we do get them the care they obviously need if it's severe enough, knowing that we can't force it on them,
Right.
but if we're going to house them and then not provide, or we're trying to provide services but they're not accepting them, what are we doing to handle that?
Right, that's a good question. What we've seen is it's been gradual. So when we checked in at the beginning of the program, hardly anyone was receiving psychiatric services. So we check in over the life of the pilot about every 6 months or so and have seen that increase. So at 6 months, it was not at 63%. I think it was around 15 or 20%. And so that's something that's growing gradually. We're very fortunate to have an excellent psychiatrist, and this is a unique program serving really hard to serve people. And so sometimes we just have to do things differently. So sometimes if you don't have a lot of money, just getting your laundry done is really difficult. So some of his psychiatric visits are taking people to the laundromat and doing their laundry with him as a way of building rapport and getting people into treatment. And so they've been very creative, and so far, like, we've seen a lot of success. And success we define as, like, is that percentage of people that need that treatment increasing, that are receiving that treatment? And so we've seen that gradually go up, and we anticipate that that will continue to grow. as far as if they're still disruptive in the home, so everyone has a lease, and so they're not on the street being disruptive. And I think some of the behaviors, so for example, like yelling or cursing or not wearing all your clothes, it's not a disruption if you're in your own home.
Right.
And so we haven't experienced those problems like we have when that person's on the street.
Got it, okay. Well, so I think that's certainly helpful information, and I think it'd be really good, especially in future presentations, to make sure we include that as well, because I think the image in a lot of people's minds is going up to somebody and throwing some pamphlets at them and like, here, take services, and like, I don't want them, and then that's it. But hearing about some of these more creative ways of getting them the help they need, I think it's great. And I think the statistics too, moving forward in future reports, you know, whereas 15%, and it goes up to 20, and then up to 30, and then 60. I think that'd be really helpful as well. Just kind of help paint some of the successes of the programs, and also where we need to work on more, and how potentially more outside resources could help with those. Because I'm sure if there's more psychiatrists, or if we had more that were willing to think outside the box like that, it'd certainly be more helpful. So, any other questions or comments? Okay, all right, thank you. Thank you so much,
you.
Sarah. Okay, that was the last of the presentations. Any requests for discussions next time? Councilman
one.
Beck?
William, I read your email that you sent this morning about the HOPE team, and I appreciate that y'all are going to bring some information back to this committee. When you do that, can you make sure that you include like resources allocated for PD and fire? But I'd also like to see historically what we've done, how we've allocated resources over time to the HOPE team.
Absolutely, we can do that.
Anybody else?
I do have something.
Oh, yes.
Thank you,
Dr. Hall?
Sharon. I just want to take this opportunity to bring up the topic of illegal gunfire. And the fourth quarter of 2025, District 6 experienced the highest number of homicides in the city of Fort Worth, with five lives lost in our area alone. During that same period, there were 24 murders during quarter 4 of 2025. And this past weekend on Friday, we lost yet another life to a stray bullet. And so this is not just providing you with the statistics, it's just highlighting the fact and emphasizing that these are real people. These are neighbors, our families, and our kids. Illegal gunfire and gun violence, they're not just affecting District 6. It seems to be an issue impacting the entire city. And it's stealing the sense of safety that every Fort Worthian deserves. So because it's preventable, I think that there should be some action taken. And I'm actually calling on our PD to launch a comprehensive campaign to educate residents on the dangers of illegal gunfire, its illegality, and the consequences for those involved. I want to encourage neighbors to get involved, organizing citizens on patrol groups and partnering with the city's police department to prevent these incidents, and providing ongoing public service announcements and community meetings. So I don't want this loss to just be an opportunity for us to say a message or share a message one time. I really think there's an opportunity for education here. I think there's a lot of guns in the hands of youth. I feel like this is a senseless, avoidable death. And I feel like we need to have a campaign that's visible, consistent, and collaborative. And this is not assigning any fault or blame at the foot of anyone, but I do think this is an opportunity for us to work as a city to wrap our hands around each other and reduce illegal gunfire and empower our residents also to take some action. So that's the challenge and that's the ask.
If I may, thank you for that request, Dr. Hall. That is not the first time that this request has been made at the city. I first made a request that we go do a creative, truly media blitz style PSA campaign about gunshots back in 2021. I think it was 2023 that I asked again that we seriously look at how we're communicating this. For some of our residents, it's a cultural thing. They don't know, they might not know that it's illegal. For others, they need to understand the harms associated with it and that Fort Worth PD is cracking down. And I don't think we do that through our normal media channels folks firing weapons in the air probably aren't also following Fort Worth PD on social media. And so we need to look at a true media campaign when it comes to this, which is television, print, getting out there, make sure we're getting this message out.
Okay. William, I think it'd be great. Oh, sorry.
Okay, we're still taking IRs, right?
Correct.
Okay. I have one. During the point-in-time count, saw a lot of familiar things, but also saw some new things come up. One of those things that I saw was damage to playground equipment. Apparently, in parks, where a lot of homeless people tend to congregate, especially after hours, there's been damage to facilities there, from roofs to pavilions to playground equipment that's been burned. So I'd like an IR on that. How much has that been, affecting, our parks, costs incurred, what types of preventative measures that we're taking to prevent that from happening?
And then, William, I think it'd be great if this body could get a presentation on some of the diversion programs that we have in the city, which ones are more proactive versus reactive, and which programs that exist for the teens, and utilization rates, figuring out, which ones should be sunset, which ones should be expanded that we can take back to mayor and council for consideration to expand. I think that'd be incredibly helpful for this body. And then another one that I know is at the top of everyone's mind right now, because it's certainly been the top of the media. I know the mayor has been incredibly helpful in this endeavor as far as getting things fixed where we can, as well as City Manager Jay Chapa and yourself, Mr. Johnson. And that is in regards to the workers' comp issues that have been brought to light that have been going on for quite some time. And so I think it'd be great if this body could get a presentation for, not just for us, but for also public consumption for the Sedgwick's claims process. Almost step by step, the average time it takes, the appeals process, and then really ensuring that we're holding Sedgwick accountable for ensuring that our first responders are treated not just promptly, but properly to get them back to the warrior athletes they were prior to the injury. And then something else, hearing about was, some things being cosmetic in nature. And maybe this is way off base, but the way I see it is if a firefighter or a police officer, if they go into, they run towards chaos and they are injured and there is something that is a cosmetic injury, whether it be from a fire or gunshot wounds, stab wounds, you name it. I think the city should be looking at how do we get them back to their former selves the best as possible, not just from a health perspective, but you consider something as simple as scars. We may consider that cosmetic in nature, but what's that doing for that first responder, that young woman, young man, their mental health? We ask them to run to that chaos, and so I think we should be restoring them back to them, their prior selves, the best we can, whether that's cosmetic or just strictly from a physical standpoint. So I think if the city has the ability to do that, we should absolutely be looking at that, because I think if you hear from our police officers and our first responders, our firefighters, our EMS, they come here to work here because they love it here, and while we appreciate them, we want to make sure that we're taking care of them. So I think just to kind of shed some light on what we can do better, where our hands are tied from maybe a state perspective, but where we can do better. And I think that'd be incredibly helpful. But again, Mayor, thank you so much for your help in getting some short-term and long-term things taken care of and working with our state level partners. But I think it'd be helpful to take that to public. So that way we can also dispel any rumors or myths and also, hold us as leadership accountable if we could be doing something more. So.
Okay, we'll bring all of those back to this committee.
All right, there's nothing else. Meeting adjourned.